Entering the hospital, I passed through many different corridors with rows and rows of patients sitting and waiting. They don't talk, they don't read, they are in pain, poor, sick, and vulnerable. I get to the 8th floor of the hospital where the psychiatric ward is. There is a large, heavy, locked iron door. I ring the bell. The door is opened by a nurse. I introduce myself. Mahvash, from the Artist in Residence program. Then I enter. The corridor of a mental ward is a significant place for the patients. They all walk around in silence alone, yet somehow together and in complete harmony. The patients are all male, female, young and old. Some of them have been brought in here from the street, most often because they created a disturbance and somebody had complained. They are poor, lost and in pain, but they only would keep them here in this county hospital for a short while, just long enough to force them to take their medication and get them halfway balanced and normal, and there they go out of the door to make room for new patients. The patient who comes towards me is skinny and has light curly hair. She points out to a box of old worn-out shoes on the top shelf of a cupboard and asks me to bring the box down. She explains she has been walking around the ward with socks only since she got in here. She explains that while she was being dragged in here, she lost her shoes. She says she had been walking around Venice Beach aimlessly for days before finally being able to collect her last bit of sense in her and call the rescue line. She says, "Yes, ma'am, I called because I needed assistance. I told them, come and get me." I ask her, when would she be released? She says, "Tomorrow, but I will miss this place. I don't really want to leave." I ask her, "But what would you miss about this place?" She smiles, showing a row of missing teeth, and she says, "The food is good here. They give you mashed potato. I don't get that when I'm out there on the street." I ask her, "What would you do on the street? Where would you sleep? And how would you get your medication?" She says, "You know how costly medicine is. I don't have those kind of money. And even if I did, I would rather pay for food and eat with it."